Which of the following most appropriately describes hemophilia? Hemophilia is a genetic disorder that impairs the blood's ability to clot, leading to excessive bleeding. It is caused by the mutations in the genes that encode the clotting factors which are located on the X chromosome. So, since the defective gene is on the X chromosome, it is classified as an X-linked disorder. Additionally, hemophilia follows a recessive inheritance pattern, meaning that the disorder typically manifests in males who have only one X chromosome. Female with two X chromosomes would need two copies of the defective gene to show the symptoms, but they can be carriers if they have only one affected X chromosome. So that means the correct answer is option B, X-linked recessive gene disorder.